Do it like
Well, welcome everyone to the 27th Degree with Chris and Nancy from 27 Degrees Consulting. I want to thank Ron Gamache, esteemed musician from the Fall River area who did our intro music, and I'm very grateful to Ron. He's a good friend and just a superb musician. So first of all, before we get going, let me, of course, thank our sponsors. Our sponsor is Bay Coast Bank. Bay Coast Bank is just right for all of your financial needs. Visit baycoastbank.com or call 508-678-7641 to learn more. So you'll notice there's something a little different today. We have headphones on, and that's because we're going to be taking calls. And the call-in number is 774-319-4230, and Nancy will be monitoring that. So if you do have questions as we go through our show, feel free to give a call. Today we're honored to have the esteemed Dr. Rajiv Nehra with us.
well, thank you for having me.
Dr. Nehra, this is his second time on the show. He has been on this show 100% more than anyone else. And
I feel privileged.
We're really glad to have him. So the first time we had Dr. Nehra come in and talk about chiropractic care, but today we're talking about something completely different, which is CBD, which there's a lot of interest out in the community about. So we're really excited to talk about it. And as a just to be upfront about things, I'm going to let everyone know I am a very strong proponent of CBD, and I support it quite a bit. So I may not be completely objective, but we're going to give you some honest answers about what CBD is all about here.
I look forward to that opportunity. Absolutely. Yeah.
So let's get started with that. What is CBD? Can you tell us a little bit about it?
You want me to take this one?
Yeah.
Okay.
Yeah, I can add on any
Sure.
to that.
So there are different systems in the body, right? There's the renal system, which involves the kidneys. There's the cardiac system, which is obviously self-explanatory. The neurologic system. There's another system in the body that was discovered a few years ago called the Endocannabinoid System, and this is involved with homeostasis or balance. Now, the thought or the idea of homeostasis or balance has been around a long, long time, but it's not something that really is talked about frequently. There was a doctor about 100 years ago who wrote a book on this by the name of Walter Cannon. He was an MD. And it was a great book on homeostasis. And just recently, we've started to learn more about how homeostasis or balance is important to our health. So the endocannabinoid system is involved with balance or homeostasis. Basically, in the case of imbalance, the system regulates physiologic systems to maintain balance. And there's a role in pain, there's a role in inflammation, in memory, in emotion, and in metabolism. So there are plant-based cannabinoids that interact with this endocannabinoid system. And these are called phytocannabinoids, okay? So they come from a variety of sources. The most common source that we know of, that we think about, is hemp and marijuana. And we're not going to talk a ton about marijuana today because our main interest is going to be hemp-based CBD. But I will just, as a broad view, let you know that CBD, which is cannabidiol, which is part of this plant-based cannabinoid, or is a plant-based cannabinoid, can be found in both hemp and marijuana, which are sister plants. In hemp, it's the majority of what's in hemp. In marijuana, we have another chemical called tetrahydrocannabinol, or THC. This is the main product in marijuana. This is what gives us those, or the users who use that, the psychoactive effect, that high. There's not much THC in hemp. So hemp is mostly CBD, marijuana is mostly THC, but both chemicals are found in either plant. There are other things that are also found in both hemp and in marijuana, and we can get into that a little bit later. But what we want to talk about mostly today is CBD, because we're interested in hemp-based CBD. And why hemp-based? Hemp-based because it is federally legal and legal.
As of 2018.
As 2018, right? Remember, marijuana, although legal in many states, is not federally legal yet.
But hemp is, as of effective the Farmers Act of 2018, which represents 0.03% of THC. So thereby, it is federally legal.
Right. And legal in most states. Like, I think there may be 1 or 2 states where it's not, but everywhere around here it's legal. The other thing I will just throw out there, we're not going to make any medical claims. You know, we'll tell you about what other persons have experienced with CBD, but we can't say this is going to cure this or cure that. So if you have questions about whether you should use this, you need to go to your healthcare provider. This is not medical advice, okay? But this is our experience and what other persons have experienced in using CBD, and that's what we're going to talk about today.
Chris, I have one question. So thank you for that introduction, very informative. So when we're talking about CBD products, am I using any like marijuana?
So you can get, once again, you can get CBD from hemp and you can get CBD products from marijuana. The ones we are interested in are the hemp-based products. We really don't have any appreciable THC in them. If you go to a dispensary and you get CBD there, you'll have a variety of options. They may have hemp-based CBD, but they're going to have a lot of marijuana-based CBD. And they're going to mix it with other things most likely. They may have pure CBD. I've actually never been in a dispensary, so I'm hedging a little bit on this. But they'll have a lot that's mixed in with other chemicals that are extracted from marijuana, THC, other. We can get into that actually.
I mean, to your point, or to Dr. Jonkis's point, I think one of the things that we focus on with explaining the difference is that we're just focusing on the inherent potential benefits that this can provide or potentially provide. But we emphasize the fact that there is no psychoactive effect. There is no intoxicating effect. There's no, in a word, high that you're going to receive from the CBD.
The hemp base.
The hemp base. So that reassures the patient that you're just there to get the outcomes to which the product will provide.
See, let me just also clarify that CBD from hemp and CBD from marijuana are basically the same chemical. So if you extract CBD from marijuana and there's no THC in it and there's not other types of products in it, you're not going to get high from that either. Right? Okay. But if you want to get it from a marijuana-based product, you have to go to a dispensary, okay, because it's not federally legal. If you get it from hemp, there are a lot of sources that you can get it from, which is good and bad because it's a bit of the Wild West out there. You need to know where you're getting it from, where you're sourcing it from.
So and I guess that's what I'm getting confused on, because I can get CBD at a gas station. I can get CBD at a clinic. I can get CBD online.
Right.
So how do I know really what I'm getting? What am I looking for? Is there a certain label?
Mm-hmm. You can take this one.
Yeah, Raj. No. So you can get it from the gas station. You can get it from a smoke shop. Or you can get it from the dispensary or a facility to which I run. But the difference that I tell to my patients is that our products are tested through the laboratory. They're tested for their purity. The purity in the sense that if we're proclaiming that it's 500 milligrams, it's been lab tested, lab sealed, that it is actually that to which we're stating. And equally important, we're also ensuring that there's no impurities, there's no other toxins, because when you make these products, they can be putting other products just to make that gummy, for example. Is there a lot of other impurities or the other toxins in that to make gummies or to make the oils and so forth? So what we're saying is that these are being tested, that you can't get insured from the internet or from the gas station or of the like.
Yeah, I mean, there's some really great products you can buy over, you can buy on the internet. A lot of the Colorado companies are quite good because they've been doing it for a long time. But there's also a lot of really sketchy products out there too, so you have to be careful. And as Dr. Nehra mentioned, does it have the amount of CBD that they're purporting? You have to make sure that that's been tested. And then does it have other things in it that are that could be bad for you, heavy metals, toxins, things like that. So you want something that's lab tested, basically, independently lab tested.
So you had made the statement that if I purchase from your facility, can you talk a little bit about your facility, where it is, and how I would go about purchasing them?
So, its its location is on Ellsbury Street, 415 Ellsbury Street, which is right across from the brand new high school. And a lot of our patients who do come to our facility, it's an organic based phenomena in which they may have a conversation with someone that has received benefit from the use of CBD, and they're not quite sure, is this something that can give them some outcomes? So they do come into our facility. We do have conversations on certain things in terms of, yes, we've had patients who have had this concern and they've had certain outcomes thereof. And we also say, try it in these means. Try it right before you go to bed. If you are a pilot, we give these recommendations. If you're a truck driver, we give suggestions on its best usage as well as the potential benefits that the CBD has. So we have a little bit of a personal approach to say, look, we're not making any medical claims by any means. And equally important, we're not suggesting that CBD is a substitution for anything. Let's say, for example, someone may have chronic pain syndrome and they are taking inherent medical medications for that. We're not saying don't take your anti-inflammatories, don't take your medications provided by your physician or the rheumatologist or the specialist. But we are saying is, if you try this and you do receive some inherent benefit, then there lies the value of what CBD can do for you. And I also take pride in saying that it does reduce any side effects. The research and the literature are not seeing side effects to the utilization of CBD, which is a nice thing to say to a patient or a potential patient that says, if it works, you win. And if it doesn't, we haven't, misrepresented any harm to you. It's not elevating your kidney enzymes. It's not elevating your liver enzymes. It's not detrimental to your stomach or your GI, or it doesn't elevate your blood. So we take solace in that there is inherent good that can come by utilization. And what do you have to lose? If you're having an ailment and CBD is a viable resource, try it. Try it. You have nothing to lose.
Yeah, once again, we're not going to make a claim that it's going to cure diabetes or anything crazy like that. And so, we're just going to tell you about some experiences that others have had, not just with our product, but, and I am involved in this product. So just as, to let everyone know that's why I'm talking so much today and answering many of the questions. But, it's also experience that others have had, throughout the world with CBD. So because we do have listeners and viewers that view this outside of the Fall River area, just to clarify, the store is on Ellsbury Street in Fall River. But there's also a website that you can go to, and we'll post this later on. But it's advancedmedicalcbd.com, and you can buy it over the internet if you'd like also.
So I'm going to circle back to something that you said about the benefits and not having side effects. What are the contraindications then to using it?
So there's a lot of research that's developing with the use of CBD. Like Dr. Jonka said, when I went to school, and I think he can say the same, we didn't know this new system, the endocannabinoid system. We didn't know it existed. It's like a regulatory system. It's a dimmer of the light. It creates balance, and it's essential in function of our day-to-day processes. So there are doing a lot of research in the terms of, is there any contraindications? Is there any contraindication of too much use? Is there any contraindication of long-term use? Is there any contraindication of use in adolescents or in pregnant women? So we are doing a lot of studies on animals. We are doing a lot of studies on in vitro experiments. And as time progresses, we are equally doing studies on humans. But again, it's a time process.
It's going to take some time to figure out. I mean, I don't mean to interrupt, but the interesting thing about this system is that, if you think about the cardiac system, right, it's there. You got a heart, you got blood vessels. I mean, people can visualize that. The renal system, same thing. They can visualize kidneys, ureter, bladder, et cetera. This is a system that's a little bit more difficult to comprehend because there's not one organ that's involved with the endocannabinoid system. There are receptors throughout the body, and they're really in almost every organ and tissue in the body: the skin, the brain, blood vessels, nervous system, et cetera. So it's really generalized.
I think that's a great way to explain it about, using the receptors, right?
Yeah, right. So what's happening with these phytocannabinoids is they are binding to receptors and then producing a certain effect by that binding action. So that's how this works.
And this bind allows the body to better regulate itself.
Right. So I'm going to mention one thing that, Raj had kind of started to talk about, and this is just about side effects and safety and all of that. I think more will come out as time goes on and there's more research. It does seem to be very safe. There are a couple things I would mention, though. Can you get side effects from it? So we have not really experienced any customers coming back and saying, I had this side effect. But if you read the literature, if you really take a high dose of this stuff, yes, you can have some GI side effects. You can, you can get some symptoms. We haven't had anyone have that because we recommend starting low and going slow, which is kind of in a way that we go. This is
it's like a barbecue.
This is kind of like when you're in medical school. It's like pharmacology 101. It's like go low and start slow and go low. Start low and go slow. It's kind of the same thing with this. You don't want to go right away to a high dose because you can have some GI distress and some other side effects. But we haven't seen that because we're not using those high doses. The other thing I'll mention is that although, once again, it appears to be very safe, there's one caution I would make. If you are on a medication that says you need to be careful with grapefruit products, this is a weird thing, like statins, cholesterol meds. The CBD is kind of cleared through the liver in the same way that some of these other meds are. It's the same enzyme. So you can have some differences in the levels of those medications. So in that case, if you have a bottle of medication that says speak to your doctor or caution in using grapefruit products, it's because it's involving this enzyme. The statins are a classic, Lipitor, Zocor. Just talk to your doctor about it. They may or may not know a lot about CBD. It's probably going to be very, very safe, but you have to know that that's potentially a caution.
And to Chris's point, one of the things that I was talking about with all this research, one of the biggest topic is CBD with drug and drug interactions. So in addition to what he is saying, that they are doing more studies that does CBD have any, contraindications of other medications such as the statins, to which he was talking about. So I wanted to add to that they are doing research, and to his point, we always recommend, if there are concerns, kindly speak to your primary care physician or to your physician and see what their suggestions may be.
I think if you have a complicated medical history, you're always best to do that with anything you're going to try, whether it be CBD or a supplement, whatever it may be. You should talk to your physician. And they may or may not know a lot about CBD, but if they don't, they can research it for you and they can let you know whether it's safe. I wouldn't give this to someone who had advanced or end-stage liver disease because it's cleared through the liver.
I was just going to ask.
That would be the other thing I would probably be cautious with, although it's certainly been done. I'm being very conservative here, so I want to be cautious and let our viewers know that these are the things I would probably take some pause with.
How old do you have to be? Do you have to be over 18 to use CBD?
Actually, there is one drug that is FDA approved for seizures in adolescents. So we typically only recommend to 18 years or older. However, adolescents are using, but it is only for this one particular application.
And this is a pharmaceutical product that they're buying through a pharmacy. So it's a little different. It's CBD in a regulated pharmaceutical form. And it's for seizures, as Raj mentions, in an adolescent type community.
And CBD is also been with FDA clearance for helping patients with chemotherapy with regards to nausea or vomiting, and in certain applications, patients that may be experiencing anorexia with regards to HIV. So there are 3 FDA clearances, approvals
Right.
that CBD has been utilized.
But 95% of the CBD that's sold out there is not sold in pharmacies. It's not for those reasons.
Right.
It's people who are using it for other ailments that they have that they want to hopefully achieve some improvement with. Chronic pain, anxiety, whatever it may be.
Inflammation. So yeah, absolutely.
Doctors, can you talk a little bit about the difference, the different products? So we have oils, we have gummies. Like, when do you use what product?
Yeah, I mean, I have some thoughts on this, but you can take it if you want.
You know, there are the most common are the oils. I think it's easy to use, it's easy access. Typically, you only use it, right before you go to bed. So I would say the majority of the use is through the tinctures or the oils. There are gummies. That's something you can take throughout the course of the day. It's easy accessible. You can put it in your pocketbook, or you can put it in your desk. And if you're taking it every 6 hours, it's easy accessible. There are different applications. For people who have, let's say, chronic joint pain, and there's topical creams that one may use, or there's balms. And now, again, with the added research, we can find like food derivatives. So people are adding it to their drinks, or people are incorporating it in their foods. So there are more and more applications, or even beauty products, in the sense that it has anti-inflammatory properties to it. So they may be using as a lip balm, or under their eyes, or just as a moistener to their skin.
I think I might go visit this little store after this podcast.
So I think about it similarly, but I'm going to give you my frame of reference and how I make recommendations, if I do make recommendations about this. So it depends on what the expectation is for the use. So the tinctures are nice because they are very readily and quickly absorbed.
And can you define tincture?
So it comes in like a little eyedropper, right? The bottles usually are about 30 mLs, and we usually tell patients to start off with about a half of an ml a day. And then after they use it for a short period of time and they've tolerated it.
And where are they applying this? How are they using
Under
this?
the tongue.
Okay.
It gets absorbed through what we call the buccal mucosa. You're going to end up swallowing some too, and it will be absorbed, but it gets absorbed very quickly. And then after a period of time, if you don't get the desired effect, you can go up to 1 full dropper full, which is 1 ml. So there's usually in a bottle a 30-day dose. That's going to be the most rapid way to get the medication, or chemical into you. The downside of that is that the flavor can be an issue. I mean, it's not horrible, but it's not like taking a gummy that tastes like watermelon. Okay.
Is it bitter? Or it's just like it has a little
like
bite.
what you think it may taste like.
It's kind
earthy.
of earthy.
Yes.
Earthy. Yeah. It's not horrible by any means. I mean, I've had some patients say that it's pleasant. Some say it's acceptable, and there've been a few who say, I didn't like it that much.
But for those that are, to Dr. Johnson's point, for those that are horrifically opposed to the flavor, there are products into which you can have a mint flavor.
Right. So there's right.
Yeah,
so there's other options. So the gummies, the difference with the gummies. So with the elixir or the tincture, I would use that if someone had a lot of systemic complaints, whole body complaints, not just pain in one little area, but their joints hurt everywhere. So they're looking for some whole body pain relief.
So it's like an arthritis.
Yeah,
type of
that's
thing?
a great option. If they don't like the flavor of the tincture, or for whatever reason, they can use a gummy, and the gummies are usually fruit flavored. Watermelon is the one that I think is one of the more popular ones. The difference with the gummies is the absorption is a little less rapid, and it can be actually a little erratic depending on what's in your stomach at the time that the gummy goes in there. Okay, so sometimes you'll get an effect within an hour, and sometimes it's 4 hours later. So the elixir or the tincture is more rapidly absorbed and more predictable in its absorption. Now, if you have just a localized area of pain, then you don't really need to take it orally. You can get a cream and put it on your elbow. and that, or a sports stick, and that works really well. You don't have to take it into your entire system. But sometimes that just doesn't work, and sometimes you do need, even in a localized area, you need the full systemic effect of an oral product. And we have customers who have used both together, and that's what they find is the most effective. So sometimes it's a combination of the topical and the oral forms.
During the summer, sometimes I'll have someone right before they go for a golf game, they'll stop by and then they'll pick up the cream and says, hey, if I can get an extra 9 holes without any duress and I lose a stroke off my game, there lies the inherent value of what we're suggesting.
And we're not guaranteeing it's going to help your golf game by any means.
That's another claim we have to say. No.
Right.
So what happens if I have to get drug tested at work? Is anything going to be picked up?
That's a really interesting question. Do you want to take this one, Raj?
With simple CBD, according to the research, you should not test positive for THC. However, there are federal employees, and we suggest, you know what, in life, it's always better to be safe than sorry. If there's any concerns, we suggest that they refrain from taking a different byproduct of the CBD.
Yeah, I mean, I'll add a little to that if that's okay.
Yeah, go ahead.
All right.
Yeah.
So when you're getting the CBD isolate, right? It's basically taken from the hemp plant or marijuana, but we're talking about hemp here. And there's different ways that can be done. So there's broad spectrum and there's full spectrum. So the broad spectrum CBD, it's distilled in a way that has less THC, but there's still some THC there. The full spectrum has more THC than the broad spectrum. So you have full spectrum, which is distilled to a certain extent.
We call it the isolate.
But still leaves some THC, less than 0.3%. You're not going to have a psychoactive effect. But could it be positive on a drug test? Probably not, but possibly. The broad spectrum has less THC, less chance of it being positive. And then there's the CBD isolate, which is distilled even more, and that has really no THC. That's not going to be positive on a drug test. So when you go to a shop or you look online, you can decide what you want based on your concern about testing. Oh. And you can either look at, if you're not concerned, I think the full spectrum is great. If you're somewhat concerned, you can go to either, broad spectrum, or if you're really concerned, go to a CBD isolate. Now, there are potential disadvantages from just doing a CBD isolate. And this is a little bit more complicated, but I'll briefly discuss it. There's something called the entourage effect, okay? So when you look at CBD and these products that are from hemp or from marijuana, there's other stuff that goes along for the ride. There's a little THC potentially in there. There's other cannabinoids. There's basically sometimes CBN, CBC, CBG, and there's these things called terpenes. So all of these have some effect, and we don't really understand completely the effect, but what we do know right now is the sum of the whole is greater than the sum of the parts. Did I say that right?
You did.
I did, okay.
Yeah.
So basically,
You're keeping an eye on them.
All of these little things in there have an effect. In isolation, it may not be that much of an effect, but when you put them all together, the greater effect is larger than you would have with the individual product. So you're going to lose that entourage effect if you're just doing a pure CBD isolate. Now, it may not matter. You may just get everything you need out of CBD, but some people find that they need a little bit of this other stuff in there. And that's why, it's important to think about that as an option. But if you are really concerned about your job and they do drug testing, you're a federal employee or a truck driver, whatever it may be, get a CBD isolate that has zero THC, because you don't want to run that risk of popping a drug test positive. And you're not going to get high off this stuff, right?
You're not going
to have the psychoactive effects, but it still doesn't mean that an employer can't give you a hard time. And even though it's federally legal, and legal in the state of Massachusetts and Rhode Island also, and most states, I think all New England states, quite honestly, it doesn't matter, because they're going to get a drug test and it's going to be positive for marijuana. They're going to say it's positive for marijuana, even though you're not using marijuana, because that's what they're testing for. They're testing for basically products that there's that crossover. So THC from marijuana, THC from hemp, it's going to still pop on a drug test. So even though it's less than 0.3% to be federally legal, if you're using it every day, potentially that becomes an issue. So you want to go with a CBD isolate if you're really concerned with your job. If you're an FBI agent or, working for the government, you don't want to take the risk.
Independent of the test, some patients I say that if this is a high concern, I will write them a letter saying you're using this for these
great.
reasons. Now, it doesn't disclaim you
Right.
from being in trouble, but if it will help you, getting it from a provider, different than the drugstore or different than from the 7-Eleven, I can write a letter saying this is of, suggested by me, a healthcare provider.
But honestly, I'm very conservative, and I don't want to have to write those letters and get in that situation. So I will tell people, look, if your job is dependent on drug testing, just go for the CBD isolate, or don't do it. But don't get anything that has any THC in it, because it probably will be negative on a drug test, but you never know.
When the drug tests come back, and I don't know if you know this or not, when the drug tests come back, does it say what that level is? Or is it just like pass, fail, or positive?
So there are different drug tests. There's qualitative and quantitative. So the qualitative ones are just going to be, positive or negative.
Okay.
But then there's an extra step you can go, and you can see how much is in your system. And remember, so in the case of THC, if you use marijuana, and it's going to stay in your system for a month. So, if you go to a dispensary and you buy some marijuana or a gummy, it has THC in it, and you use it and you think you're in the clear, you're going to get drug tested 3 weeks down the road. You may not be in the clear. And it's a cumulative effect. So the more you're using it, the more it's in your system.
So I can't just stop if I know I'm going to get tested 2 days before.
I mean, there are certain drugs that if you're using, they're out of your system quickly. THC is a little different, stored in fat, and it's there for a while.
How long does it take to clear out of your system?
About a month or so.
Oh.
Yeah.
So not addictive, right? Did I hear you correctly?
The research is telling us there is no addictive property to CBD.
Okay.
The systems to which the addiction can occur, it doesn't bind to those receptors. You can get addicted to the feeling good,
Yes.
but the chemical dependency, the research and the science is clearly proclaiming there is no addictive property. So we can make that proclamation.
So people with drug substance abuse in their past, in recovery, any type of issues with them using any of these products?
That's kind of how the whole movement started, ironically. It's that, certain physicians were finding that their patients were on these medications, and they were trying to provide a opportunity that they can sort of wean them from these medications, but at the same time give them allowance of pain management. And they felt that CBD products was a viable option to organically shift them from these pharmacopoeia into a more natural approach via CBD.
Right. So maybe this is a good time to just talk about my experience with it, because I was very skeptical about CBD and medical marijuana and all this stuff for many years. And it wasn't anything I was really interested in. And then the way I got into it, I mean, Raj and I had a couple conversations about it, because he had been recommending it to his
Chronic
patients,
pain syndrome.
well before I did. I was really pretty skeptical, but I had a couple patients who were on chronic opioids for a chronic pain syndrome, and they were, they weren't patients who were abusing opioids or whatnot. In my practice, if you're on an opioid, and very often you're going to a pain clinic if you're on a particular dosage at a certain level, but if not, you're at least coming in regularly. You're getting drug tested. You're signing a pain contract, you're doing all of that. So I have, the patients I have that are pain patients are really there for the right reasons. They're not there to scam the system. At this point, I've been doing it for a little while, so it's very rare that I find someone who is doing that. And if they get to a dosage kind of scary to me, they go over to the pain clinic and they take care of it. But the point being, I had a couple patients, really, chronic pain patients that were suffering, that were on chronic opioids, who in their own efforts, started using medical marijuana. And they were able to taper down on their opioids. Now, they didn't get off their opioids completely, but they clearly were able to taper down on their own, and there was a clear improvement in their quality of life. Now, with medical marijuana, the thing is, of course, you're going to have the whole THC aspect of it. And the THC is the psychoactive component. And when you go to a dispensary, you can get, certain percentages. You can get, less THC, more CBD. But, in reading about it, it was very clear to me that I think that the majority of the pain control comes from CBD. Now, once again, there's this whole entourage effect, and clearly THC has its effect, and, the other cannabinoids
Right.
that are available have an effect. And but CBD is probably, 90% of it. So I became interested in this through that. How can I give these patients a better quality of life and reduce the opioid usage?
Right.
Because the chronic opioids, even if you're using them regularly, they do have risk, right? I mean, everyone who's on chronic opioids in my practice, they have a script for Narcan. They have Narcan at their home
Right,
because
right.
you can overdose unintentionally, and it does happen.
Can you overdose on CBD?
No.
cannot.
Yeah, you can't overdose on it. But if you take a lot of it, you might have some symptoms, some GI distress in that, but you're not going to become obtunded and stop breathing,
Okay.
which, of course, with opioids, it's a catastrophe. It happens not
Right.
infrequently in the country.
Right.
So I was interested in doing something where I could improve the quality of life for these patients who are really, truly suffering. I didn't want to give them anything that had psychoactive effects, that was addictive. And then CBD seemed to be a natural option for that. And that's how I got into CBD. I didn't really want to get into the whole THC aspect of it because I really
Right.
thought the CBD was really the main thing, entourage effect aside. So, Raj and I had a conversation. That's how we
Yeah.
ended up kind of developing this.
And to his point, in treatment of my patients per se, in the pain spectrum, I could provide therapies for them. I could provide modalities for them. But sometimes that just wasn't enough. They felt good for that time and
Right.
place, but I felt that there was something else that they needed above and beyond whether they were seeing me for that moment in
Right.
time. Such that there was this movement with regards to utilizing CBD with pain management, with anti-inflammatory, with just reducing their inability to sleep because of the stress that this pain was providing for them. And I started suggesting this to some patients, and they were coming back with positive outcomes. And what really captivated me was a lot of my geriatric patients were starting to word of mouth find out about CBD, and they were asking me what my thoughts were, and that led me to do some research, to attend some seminars, and start incorporating. And here it is, you have a geriatric patient who is on a multi-level pharmacopoeia, and they're asking me about CBD and what my thoughts are. And again, organically, they started using it, and then it just blossomed.
Yeah, I'll just mention something about the geriatric population because it seems that's become a lot of what I take care of doing nursing home work, and also just my patient panel has aged as I've aged. So I have a lot of older people in my practice. It becomes very complicated, and a lot of older people really suffer with pain. Chronic pain is really an epidemic in the geriatric population. And unfortunately, it's undertreated. The reason being, there's a societal view that if you're old, you should have pain. And although pain is more common in older people, it's not something we should just sweep aside and allow to occur. We should try to improve quality of life and treat it.
Right.
So there's a lot of, there's limitations in what you can use in a geriatric population, just because the side effect profile is often just more notable as you age. So your ability to tolerate chemicals in your body is much less as you age. You have less physiological reserve and ability to deal with these products. So, Opioids are scary in the elderly. We do use them for quality of life reasons, but they induce falls and confusion, and falls and confusion lead to hip fracture, which leads to death. So it's not something we want to use lightly. What other options are there, really? Non-steroidals cause GI bleeds. These are things that we think of as benign, like ibuprofen and naproxen. I can't even tell you how many people I've seen, young and old, who've had major GI bleeds from these meds. They're over the counter, but that doesn't mean they're safe. There's a lot of dangerous meds that are over the counter.
To your point, too, about geriatrics, so many of our geriatric people are on multiple meds, and it seems like it's really sweet that this doesn't have an interaction with their med list.
We do check their health history. We're not randomly just giving anyone that enters the office. We do have conversations with them, and we do also make outside recommendations that, look, kindly speak to your primary care. This is what we're suggesting, but it should be somewhat of a collaborative or a team approach. Not because we're 100% apprehensive of suggesting that CBD is beneficial, but it's always good to get many parties involved, that being your primary care provider, your healthcare provider. And you'll be surprised, sometimes we invite their family members, a spouse, to come in and just take a couple of minutes out of the day to hear myself give an opportunity to educate them of what my thoughts are and how I feel it may help them. And they receive it quite, honestly, they appreciate that.
Yeah. I think it's always good to talk to your physician. I mean, even if you're going to a supplement store, or, you're getting a supplement or a vitamin, let your physician know what you're on. I think that's crucial. And, although, once again, we do feel this is very safe, if you have that grapefruit warning on your medication, then, talk to your physician, because this stuff is cleared through the liver. And if you have advanced liver disease, I would have some pause and talk to your physician.
So one other question I have is, we've talked a lot so far about patients with pain taking CBD, but what are the other kinds of diagnosis that you might want to use CBD for, like insomnia or anxiety, maybe?
I mean, I think there are there's 3, 4, 5 big ones that we see that customers use this for and derive some benefit. And then if you look at kind of national data and what people use it for, it's similar to our experience. So I think pain is a big one for CBD. Anxiety, stress, that's another big one. I think CBD does seem to help some people with that. Some use it for insomnia with really great effect. There are some GI conditions where it seems to help, and this may be due to an anti-inflammatory effect.
That's interesting.
That's that's not one of the bigger uses, but it's definitely there.
We talk about, our comments are based on personal experience, not our personal experience, but experience that we've seen in the patients that I've had. So again, with clinical research that is unfolding, and it's very promising. So I want to make that clear. The research is favorable in its efficacy, but it does have an anti-inflammatory component. And to Dr. Jonkas's point, many GI disturbances are inflammation of the bowels or the GI system. So if in fact you try CBD and it does mitigate some of that inflammatory sequential series events, then you're the benefactor. So again, we don't make proclamations to stop this particular medication provided by the your physician, but again, they're coming in, they're trying it, and we're seeing great outcomes. Not in everybody, but we are seeing great outcomes. It's not just anecdotal. And from experience, we're saying, when we do these trials and we're seeing more consistent outcomes, then we can make that application.
Yeah, there are more and more trials being done all the time. And, at some point, and eventually what will happen is probably medical marijuana will be legal federally within the next few years. And once that happens, it opens the door to a lot of research that we can't do in this country that easily now. A lot of the research has actually been done in Israel and other countries.
Canada is doing a lot of research.
Canada is way ahead of us with this stuff. Yeah.
Sure.
Yeah, interestingly. Just to back up a little bit about the effects of CBD, there are 2 receptors. There are common ones, the CBD1 and the CBD2 receptors. I'll
Okay.
just mention this, a little bit of the science behind it, but
Okay.
they have different effects. So
Okay.
when these chemicals bind to the receptors, whether it be a CBD1 or 2, or CB1 or CB2 receptor, you can have a different effect. So the 1 receptors are involved with emotion, cognition, motor control, appetite, and pain, that type of thing. The 2nd receptor is immune and inflammatory. So, and there's some crossover, right? Because inflammation leads to pain. So we know if we treat inflammation, pain is reduced. So there's definitely some crossover effect there too.
And this is science.
Yeah.
When we went to school, there was
Yes.
it wasn't known, but in anything, science don't lie.
Yes, yes. So if there's someone out there who's listening and they're like, wow, this sounds super interesting, but I want to know a little bit more about it.
Yeah.
Can they call for a kind of like just an educational consultation type of
They
deal?
can call our number. They can visit our website, and we certainly invite them to come to our store, and we can have conversations. In conversations, we can inform them, and when you inform somebody, you empower them to make decisions.
Right.
Is this a decision that may be of benefit to them? And we do describe any potential risk, such as their previous health histories. Is there any concerns and so forth?
Right. So you can, if you know what you want, you can come in the store and just buy it. If you have questions, you can come in, and Dr. Nehra, will be glad to discuss his thoughts
And you
on
can
it.
purchase online too, I believe.
You can
right?
purchase online also, and you can call also. But I think the best bet is to, quite honestly, come down to the store and have a conversation with Dr. Nehra.
Yes.
Can I ask you kind of a question out of left field?
Yeah.
What about my little furry friends?
Oh, that's a
My-
great one. Yeah, that's been a huge interest. So we do have CBD dog treats, and they look really cool. They look like little steaks.
So those are great
Yeah.
for
Little
the
steaks
Christmas
and little
stockings.
salmon fillets, and these are used a lot. A lot of the customers use this for dogs who are anxious, who are agitated, or have trouble sleeping. They get scared easily, frightened easily, and it does seem to calm them down.
For me personally, with my dog, when it's thundering, he
Yes.
gets anxious for the
Right.
the entire night. It helps. In the event that we have to travel for a long distance, we'll provide the CBD dog treats, and it just tastes like a normal. I think it tastes. What do I know? But
Have you tried the dog treats? I have not.
Come on, the salmon ones, those sound delicious.
And again, these, when I started, getting involved with regards to CBD, inevitably you hear a lot of stories, and a patient will say, my dog was on Prozac because of severe anxiousness, and then they started utilizing CBD, and it's changed the dog's quality of life. So we hear a lot of these stories, and we relay these that it's an opportunity for
Right.
for us or your pets to see if there's any benefit
That's
to them.
great.
Yeah.
That's
Yeah,
great.
and with a dog, there's not going to be a placebo effect, right?
Yeah.
I mean, with humans, you may sometimes you wonder, well, does it really work? Does it not work? I mean,
Yeah.
we have lots of customers who truly feel that absolutely it helps, but we're complicated organisms, and there is that placebo effect. The dog, there's no placebo effect.
Yeah.
It's going to work
Right.
or it's not going to work, and we have some really loyal customers who have really found that it's really helped out quite a bit. So
That's great.
Yeah.
Guys, I can't believe we've almost talked for an hour.
I mean, I
Yeah.
could go on for another
It's
2 hours
like
on this
this
stuff.
was a 5-minute
And-
conversation.
And again, and I appreciate that opportunity. What we would love to have endless time was telling the stories where certain patients, certain people, they were living a certain quality, and then they introduced this, and it has changed their quality. These are the different
Can
stories.
you share one
Yeah,
of those
maybe we should
stories with
share a
us?
couple stories, because I think the stories are pretty. This is what gets me really excited
Yeah.
about this.
Well, one that really captivated me was, again, we don't mention any names. We try to maintain
Sure.
as much privacy. I had a ER nurse who had chronic GI problems. She suffered with years of ulcerative colitis, which is inflammation within the
Sure.
bowels. And she almost knew when for a few weeks, she could start to experience, oh boy, I'm
Right.
going to start to experience an episode of it, because it would ebb and
Right.
flow. She may be dormant for many months, and it would come on. And then we befriended one another, and I expressed that, look, why don't you try it? So she tried the tinctures, and it's almost been 2 years, knock on wood,
Really?
she has not had an episode. Now, what is the only thing that has changed in the quality of life is
Right.
the utilization of the CBD. And for that, she's completely
Oh
indebted
my
to me
gosh.
that I had suggested, and it
course.
has completely changed her quality of life.
Oh my
And for
God.
people who know what Crohn's disease or ulcerative,
Yeah.
again, we make no claims this is a cure. This is a
Right.
substitute. All it was, she had the education being an ER nurse. She had this unfortunate pathology that is potentially lifelong. But if she can enjoy her child's marriage a little differently, if she can enjoy
Yes.
Thanksgiving, enjoy Christmas a little differently, because she had the opportunity to use it, there lies its value.
And this therapy is an adjunct, right? So we're not saying, go stop your meds, don't go back to your GI doc. No, you have to do all this in concert with traditional medicine. But it's something you can add that may help. If it doesn't help, well, you gave it a try. But it does help many instances. I've had a lot of different stories that, really kind of have moved me. One was, a couple were the patients, the opioid patients who, have really found an improvement in their quality of life. But I think the most interesting story I have had was I had a patient who was at a nursing home who had pretty advanced dementia and Parkinson's associated dementia. And he was just agitated all the time. He was just literally suffering. I mean, he was just, jumping out of his skin, and we couldn't figure out what it was. Now, usually in those situations, and I've done nursing home care for over 20 years, you're pretty limited in what you can do, right? Trazodone is usually the first thing you do. Maybe you try a pain medication, an opioid, Tylenol usually first. Then maybe you move up to an opioid, or maybe you do an antipsychotic, maybe an anxiolytic like Valium or Ativan, or one of those types of what we call benzodiazepines. But they all have potential side effects. And we had actually tried all of that stuff with him, and nothing helped. In fact, a lot of the stuff, you have to be cautious. It can actually make demented patients worse.
Right.
Anxiety meds, opioids, it can make them, more confused.
Right.
And the wife approached me actually, and she asked about CBD. I think she approached me. I don't think I approached her, but anyway, we decided we decided maybe that's something we could do. And she purchased some of the tincture, and it did help quite a bit. I mean, it really calmed him down. Did it calm down 100%? No, he was still agitated, but I think his quality of life was better. He ultimately ended up on hospice, and he's since passed away. But I think during that time period that he was on it, I think his quality of life was really improved, and that was really exciting to me to see that we were able to do something after he had failed so many other
Right,
products
of
and
course.
medications. So
Great. Great stories, guys.
yeah.
Thank you,
Yeah. So, once again, this is not medical advice. If you are interested in this, come down to the store, talk to Dr. Nehra, and, do things in coordination, of course, with your primary care physician.
So, have you put any holiday gift baskets together?
Oh, we got to get
That's
around
a
to
great
that.
suggestion. That is a great suggestion. We should.
Be a
yes.
great present as we're wrapping up our Christmas shopping.
Yeah, well,
Good,
we
yes.
are planning on doing that, and we'll have some Christmas sales and holiday sales, and there'll
Great.
be a certain percentage off, and so there'll be those opportunities out there. And if you are interested, once again, come down the store. We'll post our website and the call-in number for the phone line also on our site, so you guys will have that who are watching this.
Okay.
So great. Well, this was
Very
excellent.
good, yes.
Once again, want to thank our sponsor, Bay Coast Bank, which is right for all of your financial needs, and you can contact Bay Coast Bank at baycoastbank.com or call 508-678-7641. Dr. Nehra, thank you. Always a pleasure
you.
to be
Thank
with
you.
such
I
an
appreciate this
esteemed and
opportunity.
intelligent
Thank you so
physician
much.
here. We appreciate it.
I appreciate the opportunity to let our community know that we're out there and we're here to serve.
Yeah,
Beautiful.
we're just really excited because we do think it helps people out, and that's basically the bottom line. We're here to help.
And if I can almost end it, I think better things are to come with the awareness of what CBD can do. We're just at the tip of the iceberg of truly understanding on how advantageous that may be in our quality of
We'll
life.
come back in 2 years. It'll be a very different, more involved conversation about research and what's what's gone on over the last couple of
The
years.
science behind it, the research,
Yeah.
the testing on humans. It's an exciting time.
Oh, for
Yeah,
sure.
really
for
is.
sure. Thank you
So-
so much.
All right, thank you.
Thank you.